welcome back to Winnebago County Health Department TV show, where we talk about public health issues and connect them to your health. Those are some videos about some upcoming bike events that we're going to celebrate in May. Good job in those videos, Emily. Looked nice.
You're a roaming reporter.
Yeah, right? We have both of those events up on our Winnebago Health Facebook page as well. So if you want more information, feel free to log on to our Facebook page at Winnebago Health and you can connect to those details. But anywho, a proper introduction. We have Emily Dieringer here. She is the co-coordinator for the ReTHINK Coalition. And today you're going to talk a little bit about what ReThink's been doing lately.
Yeah, so ReTHINK has been kind of going through a transition process over the last 6 months. We had a lot of great work that our partners have been achieving over the last several years, and we recognized that things have changed, and well, so that they helped make those changes happen. So it's good practice for every coalition to kind of take stock every couple of years and say, are we still working on what we want to be working on? So we reviewed our mission statement and felt like that was still in line with what we wanted to do, but some of the priorities that ReTHINK had been previously working on kind of grew wings and started to fly on their own, or maybe we got enough things done that we wanted to get done and starting to look at some other emerging issues. So we held some different conversations over the last couple of months. We just held some reset events. We like our kind of puns, so ReTHINK reset events back in February. So to really give a good understanding of kind of where do we want to go now. We've got some new priorities identified, and that's kind of where we want to start working towards in the next couple months.
And you identified some problem statements on those nights. So what are you going to do with those problem statements?
Right. So the problem statements are related to our 4 new priorities. So something related to alcohol, something related to healthy foods and beverages, something related to active communities, and our new and most exciting to me is a priority is a term called social and place connectedness. So our partners helped create these problem statements. And so this is kind of the problem. So then we're asking our partners, well, what do we want to do about the problem? So in coalition, usually you work on creating an action plan. So we don't want to just go ready, shoot, aim, oh darn, that didn't work. So we really want to take time to make sure that what we're planning on doing will actually make sense and will actually address that problem. So that's why we start with a problem statement, and then we come up with some solutions to those problems. So we'll work together in our teams and come up with action plans with some specific objectives and some specific activities that will address those problems.
And you work on things called PSEs. What are PSEs?
Right. So PSE, of course, public health has acronyms all over the place. So PSE stands for Policy, System, and Environmental Change. And that's kind of where you need a coalition to work on those kinds of things. So it's not something that one entity can do by itself, but it's things that multiple partners, multiple coalitions, multiple groups can work on together for the benefit of a larger group of people or a community as a whole. So some examples of policy, system, and environment changes. Everyone's pretty familiar with the statewide smoke-free air law. That was a policy change. Something that's maybe a little more local would be changing your school district wellness policy to include language around buying local foods or making sure kids have opportunities to be physically active during the day. So that's kind of a more local policy change. Other things like systems changes are things like the Connected Community Wellness Screen at our local high schools. They're changing how they do school, so that's a systems change by incorporating that Connected Community Wellness Screen. And then environmental changes are things that are literally in the environment, in the built environment. So a drug drop box at a police department is a change in the environment that makes it easier for people to get rid of their unwanted prescription medications. Or on the flip side, something that encourages people to be more physically active, like bike lanes and sharrows, are environmental changes as well.
All right, so you've got these new initiatives. We're working a new way. There were some older initiatives, the Heroin Task Force, mental health. Are you dropping those?
Well, yeah, right. So they're not necessarily old. They're actually so exciting and so emerging and stuff that so many people want to work on that they've actually kind of outgrown ReTHINK and started their own coalitions all by themselves. So we've got the New Mental Health Connection. and that's something that's a regional initiative, so it's bigger than Winnebago County. We've got so many partners involved with that, with so many different initiatives, that it needed the support of an entire coalition all by itself. So that's where mental health has gone, kind of partly related to ReTHINK, and has really, really expanded over the years. Same thing with the Heroin Task Force. That kind of had a birth with some of our coalition partners with ReTHINK a couple years ago. Same thing, lots of exciting things happening on trying to prevent and work on treatment and recovery related to heroin and opioids. So they're having a new kickoff event. Whether or not you're seeing this before or after, it's on April 17th for community partners to get involved. And if you missed it and you want to get involved, you can connect with us at rethinkwinnebago.org. Just click the contact us and we can get you connected to that group as well.
Great. Well, thanks for coming in and giving us the update. It's just really neat to see the community voicing their needs to making this change, and ReTHINK really taking that input and going with it.
Yeah, that's how people in the community can have a say in improving the health of their community, is by being a part of something like a coalition.